Hey, welcome everybody to another episode of the Wellman's Podcast. This one I'm really, really excited about because I'm dealing with this issue right now that we're going to talk about today, and that is back pain. I'm really excited to introduce Dr. Sarvar Pathan, physical therapist, doctor of physical therapy, local to my area, Winston-Salem. I'm really excited to have him on. And also, he is also in practice with his wife, Dr. Farheen Pathan. Also, they have a mobile practice, so that's really good for a lot of people. You can find him, I guess the best would be going to his website, www.pptaw.com. And we'll repeat that at the end of this podcast. He is a doctor of physical therapy, got his education in India and also post-education here at St. Augustine University in Florida in the U.S. and Acadia University. So welcome, Dr. Pathan. Thanks for being on.
Yes, welcome.
Thank you. Thank you very much, guys. It's been a pleasure speaking to you this morning.
So is there anything that I missed with that little introduction that I should mention?
Oh, no, that's totally fine. Absolutely. I started my practice just about a year ago, so that's something that we can add.
Okay.
Can you tell us a little about your practice?
Sure. So I've been practicing for about 7 years now, being at one of the local bigger hospital systems here in town. And it was fascinating to see that I was always seeing patients on the back end of the physical therapy or health care side that patients should get their treatment. Like I would get the referral after someone has already taken multiple bunch of pain medications or already gone through a surgery, and probably would never see the people that I thought I had the most ability to make an impact on, which are the ones who are going through their day-to-day activities and probably see a twitch or a back issue. And then I always thought that these patients would, if they would call the physical therapist up front, I had the most impact to make there and, take care of the patients the best. I saw the latest statistics, about 96% of the lower back pain that we actually experience is reversible and addressable. Only 4% goes into a diagnosis of like cancer or like infection or any of those sorts that would actually require immediate attention. And I wanted to make sure that I can get in that front side of people's lives and make a better and bigger impact rather than just seeing them after surgery when I have only so much to work with.
Yeah, I love that because for people who don't know, in physical therapy, one of the biggest pushes that they're trying to make now with our legislative body is for direct access. So like a patient could come see you directly before they have to get referred from a physician. And that speaks a lot to what you're talking to. And I love how basically what you did is kind of put that in your own hands by having this concierge service where people can come get your services without that need. So you're really doing it yourself. I love it.
Yep.
The other thing about it is with the way the system's set up, at least from what I see with back pain or any type of pain, it's usually you go to your doctor and they give you some sort of pain med and then send you on your way and say, well, call me in 2 weeks, so to speak. And they're not really getting to the heart of the issue. So yeah, it's almost like the physical therapist really should be one of the frontline people besides the MD for, especially when we're dealing with back pain, when you just said 96% of it is reversible.
Yeah. And, I would probably blame it on, the big, huge market and economic engine that back pain is being considered by the U.S. So, in 2011, Forbes magazine, estimated that the back surgery market in U.S. was $40 billion.
Wow.
And research on typical back surgeries show an average price of over $100,000 for a fusion surgery, which is nearly 55% of that cost due to the expensive medical implants. And so all of these companies that produce medication, medical devices, operate surgical centers, all of those, they're promoting pills and medical devices and and doing all of those marketing. Like one of the companies, it's a medical device company called Biomet Zimmer. They spend nearly 40% of their revenue on marketing. So they're always talking to these doctors and surgeons, sell this product so the economic engine continues to work like they want it to work.
Yeah.
The other thing about back pain that I've experienced too, because I get a lot of back pain in my clinic and treat them with acupuncture, but it seems like the surgeries, do you have any statistics on the surgeries actually being successful? Because I see a lot of people get the surgeries and they still have the pain.
Oh yeah. The problem is they look at the X-ray and the MRI, and there are multiple research which proves that, okay, the X-ray and MRI is a still image and you do not see the actual cause of the pain based on what you are trying to prove that, okay, here's the problem, let's fix it. There are many different pain generators and pain sources that come out of the back pain. There's so many delicate structures, there are so many firm and hard structures, and there's so many reversible, modifiable structures in the back. And so from a surgeon's perspective, as we all get narrow-minded, and maybe I am from my PT perspective, and a surgeon is from their perspective, and whoever other professional is, but opening and widening that scope, which is very difficult to do, will help the ultimate patient, is that the surgeon is looking at that MRI and saying, ooh, that's a disc bulge. And I just posted a post last night on the social media that there are evidence two MRI screens. They're almost looking similar. One has a smaller herniated disc. The other one has a bigger herniated disc. Both should have never received a surgery and actually didn't, and did really well with anti-inflammatories and physical therapy. And so when they're trying to do the surgery, they're not really addressing the cause of the pain. And so the cause is still there even after they've fused it, or even after they've scraped the disc off or taken the lamina out of the spine, which is just horrible. And they still have the pain.
Yeah. So what I hear you saying is it really should be like one of the last resorts when you see everybody else, the more non-invasive approaches, which tend to be the most powerful approaches before you even think about going to surgery. The problem I see is that most people are talking to the surgeons about surgery before they're actually talking to the PT people or anybody else that's not in that paradigm. So of course they're in their toolbox is a surgery. Let's do surgery and that will take care of it.
That's so true.
Yeah, it's such a crazy thing that how many people are getting back surgery right now for things that can be completely reversed.
Right. And I don't remember the exact statistics, but I know in most MRIs and imaging, they'll see a herniation or some sort of problem or a loss of disc height, and the person could be completely asymptomatic, so not have any symptoms whatsoever, but they see there is a herniation here, or there is a slight tear here or something like that, and you can be completely no symptoms.
Yep.
So if that's your first line of defense, kind of, you have back pain, the first thing you're doing is getting the MRI or X-ray. It's likely to show something. And then again, as Keone and Dr. Sarvar just mentioned, if the person who's consulting you there is the surgeon, like Dr. Sarvar said, we get narrow-minded just in our own practice, and his method is surgery, or their method.
Yeah. So with the herniated disc you're talking about, the example you post on social media, it seems to me like the layperson's gonna, the doctor's gonna show the layperson that image and say, see, here's the bulge, and then the next step, it's pretty obvious. Well, we just got to cut out the bulge, take out the bulge. But from what I'm understanding is can that bulge be reabsorbed back in with the movement of the spine, or does the body is the bulge there and the body just adjusts over time to cope with it?
So beautifully, our body, there is a book written by, I believe, Deidre, it's his name, and I can get some more information. But he recommends in his book that our bodies are designed to last up to 110 years of the way how it's structured. And having pain is normal, but it just continuing to have that as a constant within our body is not something that you should accept. Now, with the herniated disc, the point that I wanted to make was our bodies heal all the time. And so the same thing happens with the herniated disc is if suppose that was a reason for the pain. And the way how you confirm that that is the reason for the pain is by doing physical tests and measures. You have to actually see if this particular movement is linked towards causing the pain and if the sciatic nerve is being pulled. And there are specific tests to prove that. And that's why MRI and X-rays are not the best tools to diagnose these herniated disc conditions, because it may be visible, but that's not really the cause of the pain. So once you find that this is the cause of the pain, there are many methods in physical therapy that allows you to heal those herniated disc structures. So the way how physiologically the herniated disc improves is, there are different stages of a herniated disc. There's a bulge, there is a herniation, then there's a sequestration. So based on what level you're in, and most, there are 5 stages. So out of the 5, 4 of those stages are something that you can easily address through movement. And so through healing, the actual disc that has bulged, that has the ability to get reabsorbed back to where it belonged. It is a vacuum structure, so there's a negative pressure inside the disc. And so when you have that negative pressure, it does get sucked back in. Now, the point is, okay, if you can keep it there. And so there are annular fibers that are on the outside. And again, you have the ability and time while you're working through the movements to allow those annual fibers to come over and cover that area. So there is the break that actually happened because of why the disc got herniated gets closed back up again. But, very subtle movements. There are going to be some limiting movements in the initial stages when you are going through the pain from the herniated disc. But it is possible for you to have complete recovery with no pain after having a herniated disc also.
Okay.
Yeah,
it's good. That's incredible to know. I don't think most people know that. I think most people with herniated disc just assume, okay, well, I probably need surgery with that. But what you're saying is most people probably don't.
Yep.
Yeah.
So with the herniated disc, we're talking about back pain, but specifically, I think we're focused on low back pain with that. Is that where they mostly happen, or can they happen anywhere?
So our disc is located at 28 places in the spine, so it can actually happen at any of those. Yep, from the neck to the mid back to the lower back. And
you keep talking about movements as far as specific physical therapy movements, which I translate into instructional kind of like therapeutic exercise.
Yep.
So with your PT, how non-invasive is that, right? To prevent you from going under the knife.
Right.
I guess my question to you then is when do we know? So I have a particular patient that has back pain. When do we know when this is serious, and when should they possibly be followed up, for surgery, or you mentioned at the beginning of the podcast, possibly cancer. Can you just talk about that and back pain?
Yeah, sure. So, the beauty of being on the medical side and learning the back pain is the actual differential diagnoses of different types of pains that a person goes through. So, I have actually met in the same town that I live, personal trainers and massage therapists who claim that they can, fix back pain. And I don't say no to what their abilities are. The thing is that, there are certain types of back pain which are relatively simple and easy to fix, and probably are so easy that an individual, if they learn themselves, would be able to fix it. Now, to be able to differential diagnose is this something that is normal and will heal within 2 or 3 weeks, and I just need to, look out for my movements? Second, is this something that I need to get an extensive examination with a professional, which could be a physical therapist, and see if how I can prevent it? And then the third level, something that they need to see their surgeon or their medical doctor for, that it could be coming from like a kidney stone, it could be coming from like a ureter issue, it could be coming from like a cancer and infectious origin. And so being a doctor of physical therapy, with our schooling and of the way how our structure is set up, we are set up to give you the guidance and advice on all 3 levels as to, okay, well, this I see has a red flag, and red flag would be equal to something that has tingling and numbness going down the leg, their urinary capacity, and their pelvic condition. They're not able to do their normal bowel and movements, bowel and bladder movements, and are experiencing excruciating level of pain. So that requires some sort of invasive procedure if it was immediate, but also down the line. So my point would be, if you see any red flag conditions, and the red flags, as I said, would be any urinary incontinence, extreme levels of tingling and numbness in the legs, weakness that they're not able to stabilize themselves, or they have fever, then that would be something that they need to see like their medical doctor, or go to the emergency room maybe.
Yeah, and typically with what you're saying, and what I find is, and this happened to me twice over my career so far, but back pain with treatment that just does not get better or gets worse it can be a big red flag. You try everything and nothing's getting better. So a couple times in my career treating back pain, it ended up being a prostate issue or prostate cancer. That was one of the things. And so as a physician, as a healthcare provider, knowing what those red flags are, one big one is just not getting better with treatment.
Right. True.
Yeah, I would add also a change in position, because it is so mechanical and you're stressing different things. If your pain isn't going away with a change in positions, a certain sort of position makes you feel better, then it could be a little bit more sinister.
Yeah. Yeah. So most of the back pain that I see, people have gone to their physician, unfortunately not their PT, but have gone to their physician, and typically they're coming with a diagnosis of musculoskeletal pain. Is that typically, or they're saying it's like a muscle spasm? Is that typically the number one cause of back pain, would you say?
Yeah. So believe it or not, the most interesting diagnosis that I saw on my day-to-day practice when I was at this hospital system, 85, I would say probably 90% of the diagnosis was non-specific low back pain. Okay. And what practically means is, oh my God, I don't know what's going on, but I know I have a solution, pain medications, and if it doesn't work, we'll look into what's going on by taking an MRI, and take these and we'll see you later. So because the doctor at that instance either didn't have the time to examine what was going on, or that felt, I think the next patient probably has much more urinary catheter difficulty, or a previous patient had much more extensive conditions. So this back pain is relatively simple, and probably it's okay for them to not be in immediate relief, and so it's so they are not probably focused at their quality of care, and they only have limited time, and that results in poor quality of care, and they're not getting the right quality there. So yeah, and immediately you see that obviously the marketing, the way how it's set up is, okay, they're probably towards medication and surgery, and so they may not be getting a referral to physical therapy.
Right. Yeah,
that's what we see a lot in PT, is like, because we have different modalities and ways to intervene, but our true knowledge base is in the anatomy and the biomechanics, and no one has that vast level of knowledge in anatomy and applying it like that. So a lot of times your physician referral, Keone, is low back pain, eval and treat. Or if it's like, if someone has pain in their elbow, it doesn't matter what it is, they're going to call it tennis elbow and send you the referral. They're going to say lateral epicondylitis, and you're going to get a referral for that. And you have to figure out what it is, basically. And so there's a lot of that where it's just with low back pain, like Dr. Sarvar is saying, the physician sees them and you can get an MRI, and then we can put you on these meds and so on and so forth.
Mm-hmm. Yeah, it seems like a pretty easy thing, right? I imagine, it's like, oh, okay, yeah, back pain, and if it's not obvious, and this happened to both of my patients with the prostate cancer, where the referral came to me, right?
Wow.
Because it was
Yeah.
a non-specific thing, and I'm trained as a primary care physician, but also I do primarily acupuncture just for pain management.
Hmm.
And so then my thing, treat for like 3 treatments, nothing is getting better, and then I'm thinking, well, you need to go back and talk about this to your doctor and look further with checking the prostate and all that stuff.
Yeah.
But yeah, it's go
And
ahead.
looking over our questions for today, just thinking about when do you need to seek out surgery or something like that? When do you have to go further is when
Yeah.
conservative management is not working. When consistent conservative management, which is what you just mentioned, 3 weeks of treatment is not working, then that can definitely help clue you in that something more sinister is going on.
Right. But the system is set up really messed up, right? Because you guys, the patient ought to be coming to you guys first, and then you could skip all the middle steps, or you're going to be more likely to figure it out and really isolate what's going on.
And we can tell you, hey, this is not musculoskeletal. And then
Right.
at which point we can refer to the physician who could find out that it is indeed a prostate problem.
Right. Right. So I guess the other thing I have to say is, and this is interesting. So for me, I treat back pain just about every day, but for me, it's symptom management. You know what I'm saying? It's like I'm going to help them with their pain so they don't have to be on opioids or pain meds, or they can at least reduce it. But for me, if you can just talk a little bit, Dr. Pathan, about like the role of an acupuncturist as opposed to a chiropractor, as opposed to a physical therapist, and how they all treat back pain, and who should they see first for that?
Sure, absolutely. So I have a very systematic way of looking at things, and I inherited that from uh, a model of a school of thought, which is called the movement treatment. And there are 4 specific levels. I call that the pyramid of physical freedom, and that's a system of 4 levels that a treatment intervention should go in for an individual for low back pain. So, the first level, and this is a pyramid. So I think the pyramid has the stronger base. So the first level is the nervous system downregulation. So what we see most often is when you have an experience of low back pain, it very well is a case that you have some sort of emotional and some mental correlation with that low back pain, which is affecting, let's say your ability to work now. And so now, because you're not able to work, you're emotionally, feeling that you're not going to be able to provide the food for the family. And so you're not being able to stay productive with your activities. So there's a lot of components that goes into experience of a low back pain. And because of all of this, our nervous systems heightens and exacerbates the actual physical pain response. And it's so important to downregulate that heightened nervous system before you try to move or stabilize or strengthen any of the structures. So that would be my first line of treatment into addressing the nervous system. Now, who can provide that level of calming effect for the nervous system? I think acupuncturists, massage therapists, physical therapists, all of those are set up perfectly to help them learn, first of all, listen to their problem, learn about their problem a little bit more into detail, and then explain and educate what's happening, why we are seeing a heightened response to the pain, and who you should be seeing for this stage of your life for your lower back pain issue. The next stage that they move in, again, thinking of the pyramid, is the mobility and the stability training. So at this point, once the heightened pain response is gone, then you move into looking at individual joints, individual structures. Let's say if it was for lower back pain, you look at obviously the lower back pain and the spine, but you also look at the sacroiliac joints. You also look at the hips. You also look at the mid back, because all of it is connected. Maybe leg length discrepancy, shoe, footwear, and then looking at all of those movements, how they're moving, if there's any stability issue or there is any mobility issues. So is the structures tight, like your hip capsule has a tendency to get tight? Are the hamstrings have a tendency to get tight? So are those tight, and do we need to relax them? Or that your core muscles are unstable, your mid back is not strong enough, your posture is not ideal. And so at that stage, physical therapist is set ideally to break down individual segments and to provide that level of care at that stage. The third level would be quality movement patterning. And so what you're doing at that point is, once you have the individual segments and stability and mobility addressed using the corrective form of exercises, the third level is you are providing the right quality after seeing that all of these joints and structures are moving correctly. So a movement could be you're trying to bend over and pick something up, and you look at, okay, so probably instead of bending, maybe use some of your bending at the knees, and then you're trying to retrieve something out of your back of the trunk, and you see, okay, probably you need to set your knee on the trunk instead of just reaching for whatever it is in the deepest part of the trunk. And so, breaking down the individual movement pattern, and at that point, a movement expert would be beneficial. At some levels, some high-level personal trainers have good, solid movement patterning ability, so personal trainer would be beneficial there, but obviously physical therapists are trained to do so. And then the last level is the strength and conditioning. So once everything is, let's say stable, mobile, and the nervous system is completely relaxed and you're moving well, then you just strengthen on top of all of those structures. And based on individual levels, I think every clinician and every healthcare professional that practices medicine has value, has factor. Like for stability, I think mobility, I think a chiropractor is also a good person, because it also has the ability to give you that movements you need on your spine. Yeah.
Okay. Yeah, no, it's great the way you broke that down. I guess one of the things I see with most people, and it's including myself with my back pain over the years, is most people, before they see anybody, kind of self-treat. Do you have any advice about self-treatment and when you should actually see somebody when you're experiencing back pain?
Well, yeah, absolutely. So, for if back pain is not getting better over 2 to 4 week period, I think that's the time to see someone. But I think you should give about 2 weeks for yourself to look at what's going on. And again, this is after, let's say, a known injury. Okay, so like if it just sets in out of the blue, and you certainly wake up one morning with excruciating level of low back pain, well, that's a different story. You ask for help at that point. But if you had an injury working in the yard and you did something, and you can see that, okay, I'm only hurting when I bow forward, and I think I'm at a relief when I lay flat on my back, that's a good point where I would say, okay, it's okay for them to take a little bit of time and self-treat. Best case scenario, self-treatment, definitely use some bracing for their back, because what happens is structures, when they're in pain, they're in a heightened response and called muscle guarding. And so the body's already providing that muscle guarding effect. And so a using of a brace will help aid those muscles relax down and decrease some of the pain. Using anti-inflammatories is great. I cannot prescribe any, but you can always find over the counter. Those are great, so you should take those. And you should also make sure that for the first 24 to 48 hours, just take it easy. Don't push into your pain, but not necessarily rest. But stay active. Like walking is great activity when you're trying to kill the immediate acute nature of pain. Once you are out of the acute nature of pain, which usually takes 24 to 48 hours, maybe up to 72 hours, then you start to explore, okay, which movements are healthy and which are not. So like, bowing forward is usually going to be painful. Bowing and twisting is going to be painful, but backward bending is going to be easier, and not all cases, but most cases. Mm-hmm. So laying face down and then propping your hands and forearms, and then probably pressing backwards. That's a good movement to do to help with the back injury. And then you move into the stabilization aspect of exercises. So then, tucking the tummy exercise and some gentle stretches like child pose stretches, knee to chest stretches, maybe lower trunk rotation stretches are good. Again, all of this is in the first 2 to 3 weeks, and things are improving. Then I would just continue doing so. If you still continue to have back pain, then I would recommend seeking advice.
Yeah. So what I hear you saying is with movement, back pain can be self-treated with like gentle movement. And it's interesting because at least 20 years ago, it used to be, oh yeah, back pain, bed rest, take it bed. And that's exactly what I hear from you saying, probably the wrong thing to do. Oh
yeah, big time. There's multiple researchers now coming out saying, okay, rest was the worst advice that people could give. And probably someone who is suffering from chronic low back pain was given that advice and has that pain because of one of the reasons was he rested for like full week or 2 weeks.
Yeah. Right. Which made it worse. When you say bracing the back, what do you recommend they use for that? I mean,
it could be anything over the counter as a lower back stability brace. Or, Walgreens, Walmart, CVS, Amazon's is great. So you can look up there. But yeah, there are different types of braces also. So based on what the condition you're dealing with, do you want to stabilize your paraspinals along the length of the spine? So there are like stirrups set up on the brace that you can use. There are elastic braces, and then there are like double fastening strap, adding more stability to the brace. I think these are more just marketing strategies, one better than the other. As long as you got something around your hips that you can stabilize it, you should be good to go. You don't have to worry about what kind and what type.
Okay. Yeah, in that immediate stage, you want to keep that lordosis, that lower back C curve, because as you mentioned, bowing forward, that's most of the herniations occur posterior. And so if you bow forward, you're spreading those annulus fibers apart, like Dr. Sarvar mentioned, and thus the nucleus pulposus stuff, the deeper stuff of the disc, has more of a tendency to kind of leak out that way. So you want to stay more in that lordotic C curve of the lower back, especially if you have an immediate disc pain. And with disc, it's a little bit more immediate, and it happens to a little bit more of a younger population. So like a 45 and below type population, because they're a little bit more mobile. Disc is a little bit more full of fluid. And then you'll notice it. So if you go down, you have that kind of immediate pain with that forward bending, likely a disc.
Yep.
The other thing you mentioned, Dr. Pathan, is you mentioned like anti-inflammatories and stuff. And one thing I'll do with some of my patients is I will use anti-inflammatories, and I will use natural ones and natural muscle relaxers, although they're not as quick acting. And my favorite natural muscle relaxer is, and Brian and I've talked about a ton, is magnesium, either topical, oral, or both. You're probably not going to notice something overnight with that, especially with acute back pain, but over time it can certainly help. And then my favorite anti-inflammatory, again, it's not going to be quick acting, but over time it helps, is from the herb turmeric. It's called curcumin. If you can get away with that, you probably can reduce your doses of the other over-the-counter NSAIDs. And it's much safer, much safer to use.
Yeah, absolutely. I actually saw a patient yesterday who is a very true religious follower of natural medicine, and she mentioned all of those names because she has them with her, and she knows what to take if it is anti-inflammatory need. Boom, she takes the turmeric version of the medicine, and then vice versa for the muscle relaxant.
Yeah, and again, like I was saying, it's not as quick acting, but it certainly can help. And in the world that we live in right now, we have an opioid epidemic going on here. I mean, tons of deaths, overdoses, addictions from our pain management, institutionalized pain management that we have, conventional. Can you speak of anything on that with the muscle relaxers, painkillers, and how you may have a better approach than what's actually going on now with that.
Yeah, I think what has happened over the years is that, because the pain response or the pain that people were experiencing was only treated by pain medication, the 6-week follow-up would add a little bit more doses to their medication. And then obviously the pain is not getting better because it's something that, you would want to be addressed stability and mobility wise. And then you're moving, going back to the doctor. And so they reached to a point that, okay, well, this is the highest dose of pain. And it was okay and it was fairly, legalized at that point to, give out the high dose pain medications like hydrocodone, oxycodone, morphine, and all of those, fentanyl. And so it was, people were taking it and people took it. Now, the thing about with those medications is obviously it causes addiction, but it also makes your pain just reach a central sensitization level. And what I mean by that is your brain then perceives the threat as pain, no matter what the threat is. The threat or danger signals that are coming, it could be just a sensory deficit, or it could be like a little bit of a burning sensation, or even a stretch response, like when you're doing stretching. All of those, which are normal symptoms, gets perceived by the brain as a pain response. And so this goes into the brain, and this is research, and there are a couple of scientists called Lorimer Moseley and David Butler out of Australia who have done multiple research regarding central sensitization and allodynia, which is like experiencing normal touch sensation as pain. That all of these people who have been taking all these medications, their pain response is so heightened that they only can decrease their pain level only for the short term using the opioid medications. Now, you have all of these people who have been taking these medications for so long, and they're now on that chronicity level. But now with the newer regulations, they can get those medications, so they're not having to use other medications or other strategies to help themselves. And so you see all the withdrawal symptoms, and then you see all the death because then they try to seek it from illegal resources.
Right.
And so it's something that if we could have through the healthcare system understood the referral patterns better, and then from the U.S. perspective, if the marketing was probably directed towards natural medicine versus medications and medical implants and surgery, I think the situation can improve drastically.
Yeah, it's crazy. So they have this heightened pain response from just things that should not even cause pain after a while. And it's interesting. You just brought it up. Like once the doc takes these pain meds away from them and they're addicted. I mean, I was talking to somebody who had an addiction issue with them. They basically said, my every cell in my body is screaming for this med, and now I can't get it. And when you have something like that, and you can get the street drug, the synthetic forms, which are very, very dangerous because you don't know, they're not standardized. You don't know what you're actually getting. It's like they just want their fix, and that's all they can think about. And I think you're right. I think you hit the nail on the head with that, is that's when we start seeing a lot of the overdoses.
Oh, yeah.
Well, with the medication, it's like they put you in a closet for 1 or 2 weeks, completely dark, and then you walk out into the sun and you're like, holy hell, it's bright. And that's how it is with pain. It's like, yeah, no shit. You turned it off for a while.
Yeah. Is Dr. Pathan, is there anything else that we should hit on, or you think our people would want to know about back pain?
I think there's always a lot that I can offer, and I can talk about back pain, but we want to be respectful of people's attention and time, and so
and we want to be respectful of your time too, because I know you're doing this on the weekend, so we want to give you some time to relax.
Vice versa, yeah. So something what I probably would want to add is maybe for the listeners, they can add something to their toolbox, as I call this the healthy back test. And what we can do is, instead of elaborating what the test is, we can send you a link on that. And these are 6 movements that anyone should be able to do and should be able to rank themselves at what level they're at, which is, are they at healthy back? Are they at average risk? Are they above average risk? Or are they at high risk of having back pain?
Awesome. Is this something you created?
This is something that, no, not I created, but it is a very valid test.
Okay. So it's like an outcome measure kind of with.
Yeah, it's a screening tool.
Okay.
Yeah.
I look forward to checking it out.
So when we post this, we'll have that link so people can
have it in the show notes.
Okay. Yeah. That'll be great. Well, thank you again, Dr. Sarvar Pathan, Doctor of Physical Therapy. Really appreciate it. Let me just go over how you can reach Dr. Sarvar Pathan and also his wife, Farheen Pathan.
Yep.
We're going to have her on, I'm hoping, soon, also to talk about women's health, which I'm really looking forward to. But you can reach both of them at www.p as in people, so pptaw.com. You can also reach them. Their phone number is 347-553-8801. Personalized Physical Therapy and Wellness. Check them out on Facebook, online. And tell you what, they're a gift to Winston-Salem. They're in the area. They're in the Triad area where I am. So if you guys are in the Triad area, look them up.
Absolutely.
Thanks for being on, Dr. Pathan.
Awesome. Thank you. Thank you for having me.